Okay, it looks like we've got a good group in the room. Thank you so much for joining. We'll go ahead and get started. This presentation is offered through DHCS and is a resource provided through MTAC, the Medi-Cal Mobile Crisis Training and Technical Assistance Center. And as we've said, the title of this presentation is Accessibility Strategies and Crisis Response for Rural Areas.
Great, thank you, Avery. So as you know, mobile crisis services are designed to provide rapid responses to individuals and community-based stabilization to Medi-Cal beneficiaries who are experiencing a behavioral health crisis. Really, these services are designed to provide relief to beneficiaries through techniques such as de-escalation and stabilization. We want to remove immediate risk of danger and potential harm and avoid unnecessary emergency department care, psychiatric inpatient hospitalization, and law enforcement involvement. So what our BIN is trying to do is to take us in a new direction for mobile crisis services in California so that it's really focusing on resolution and relief to people in crisis in the community. And really want to support people in crisis and meet them where they're at and try to use the least restrictive means necessary. So you're going to hear some things throughout all the trainings that are very, very important to DHCS and to all of us, which is that mobile crisis services should be person-centered. They should be trauma-informed, equity-driven, brief interventions that really focus on de-escalation and are resolution focused. We're working from a lens and an approach of the least restrictive interventions, and that we're really working to be culturally responsive and linguistically appropriate and accessible so that everybody who is receiving these services feels that the things that they need most to move through their crisis are things that are accessible to them and that are supported by the team that's there. So we're going to do a few general introductions. First of all, I'll have Avery start and just give a little bit of her introduction, and then I'll jump back in.
Awesome. Thank you, Jennifer. Again, I see folks are continuing to join us, so welcome. So pleased that you're here with us today. My name is Avery Bellew. My pronouns are she and her. I'm a principal with Health Management Associates. And my context, my professional background, I've been working in suicide prevention and crisis intervention for about 15 years, including for the Suicide Prevention Resource Center, the National Action Alliance for Suicide Prevention, thinking at a national level about specifically the crisis of suicide and appropriate ways to intervene. For today's presentation, I'm particularly passionate about this topic because I, perhaps like some of you who are attending today, grew up in very rural parts of our country and have spent a large part of my life in rural communities. And I'm particularly passionate about not just the challenges that rural communities face, but also the unique strengths that they have. And so I'm really excited to have this conversation with you today. Jennifer?
Great. Thank you, Avery. And my name is Jennifer Hodson. I am a principal of Health Management Associates, and I am just very, very passionate about behavioral health. I've done all kinds of work with people in crisis situations in a variety of contexts, from crisis intervention lines to working in primary care settings where we develop crisis protocols. So I'm very passionate about making sure that we're delivering the right size service to people in all areas of our community. And I've also done a lot of work with FQHCs, which, if many of you know, are the place where a lot of our underserved and underinsured seek healthcare. So, and you'll learn throughout the presentation today that the more rural, oftentimes, the less resources and the more need. So that's why this presentation is so important to all of us today.
So we want to spend a few moments talking about where we're headed today. And I'm just going to reiterate something Jennifer just said. I'm so glad so many of you are already finding the chat. We've built conversation in throughout this presentation. We know you're muted, but we would really like for this to be as participatory as possible. So please do find that chat if you haven't already. Introduce yourself. Tell us if there's something you're particularly hoping to learn about accessibility strategies and rural communities as it relates to crisis response, because we are going to be looking at that chat. I have it brought up here in front of me, and we'll be looking at it throughout the presentation. So here's where we're headed today. We've already done our introductions. We're going to talk about what are rural areas. How are they technically defined in the BIN? So we're going to spend a moment with that. We're going to talk about strengths and challenges from a broad level about rural communities. We're going to do a bit of a deep dive into substance use disorder in rural communities and behavioral health. Then we're going to talk about crisis response in rural areas. And we've identified these kind of 4 buckets: timeliness standards, workforce recruitment and retention, telehealth, and safety concerns as being 4 that are of key concern for perhaps many of you as it relates to crisis response. But we'll create some opportunity to hear if there's other areas that you're also interested in learning about. We're going to talk about community engagement and how that's a key part of this work. And this builds on prior trainings. If you've been coming to many of these trainings, these are really building on each other. So this builds on prior conversations we've had together about community engagement and collaboration for the purpose of effective coordination. Then we're going to summarize all that we've learned together, and then we'll have some opportunity for Q&A. So that's our agenda. That's where we're headed. Here are our learning objectives. These are the things that we're hoping all of us will come away from this training having learned. Again, we're going to talk about how rural areas are defined, so you'll have a clear understanding of that. We're going to understand what the behavioral health challenges are that are unique to rural areas. We're going to describe potential accessibility challenges for rural communities. We're going to summarize these key strengths and challenges that are related to mobile crisis services in rural areas. As we've described, we've talked about kind of 4 buckets, and we're going to talk about potential solutions. That's really the important part, right? So we have some solutions to share with you, some practices that other folks have implemented across the country that are promising or best practices. And we're also interested in hearing solutions that you may have identified so you can share those with your colleagues. If there are solutions, innovative things that you're doing, we hope this is a collaborative learning space. And then we're going to share with you some resources where you can keep your learning going about rural communities and mobile crisis specifically. So now let's spend a moment talking about the strengths and challenges that may face rural communities. So what is a rural community? Let's start with that question. So the BIN has a very particular and specific definition of rural community. It uses the alternative access standards for Medi-Cal managed care health plans and their definition of rural, which is defined this way: its areas with less than 50 people per square mile. So for the state of California and the purpose of our conversation, that includes 21 counties. You see those counties listed here below. I will also note that while there are communities, of course, that may have parts of their counties that you feel are rural. And so even if you're not in one of those counties listed, I would make the note that there are likely parts of this conversation that may be applicable to you. There's an additional 19 counties that are listed by the alternative access standards that are small but not rural. And so you may face some of these similar challenges in pockets of your counties or community. But for the purpose of this conversation, there are 21 counties that are specifically designated as rural. So what about challenges and opportunities? And I see also, we see a hand raised. So if you do have a comment for us or a question, if you could put that in the chat, and that'll be the place where we're able to respond to any questions or comments that you may have. So if you could utilize the chat, just the general meeting chat, or if you have a question for a presenter, you can also send a chat directly. So we're going to talk a lot about challenges, and we're also going to talk about strengths. But in general, we want to kind of have a level playing field to say that there are some general challenges that face rural communities as it relates to crisis response and behavioral health and substance use treatment. The research lists these, and we're going to go into a deep dive on many of these. Some of these being included are fear of stigma within rural communities, lack of anonymity when seeking care. So sometimes because of the close-knit nature of communities, individuals being concerned about their anonymity when they are seeking care, shortages of mental health care providers. And this certainly is a large challenge for many rural communities. In many ways, what we're here to talk about today, which is mobile crisis, is a response to some of these challenges. And so that's one of the interesting things about this conversation today. We'll be talking about some consistent challenges as it relates to behavioral health care. And in sometimes mobile crisis is actually part of the solution or is the solution. Lack of culturally competent care for a variety of different individuals. We'll be talking about that today. Transportation challenges. individuals not being able to access care because of lack of access to consistent transportation or to public transit, and then just geography and distance and all the challenges that that can present around folks' ability to get to care and to receive care, and for folks who are responding to crisis to reach folks who need care. We'll be talking about a lot of these factors today. So you're going to hear a lot about challenges, but we also wanted to take a moment to list strengths. Rural communities have a lot of unique strengths that can oftentimes serve as protective factors for mental health and behavioral health. And some of these include close-knit communities, social bonds, community interconnectedness, civic engagement. All of these things are protective factors. Folks are generally self-sufficient. And while sometimes that's not to someone's benefit, self-sufficiency can certainly also be a strength. The same for independence, that folks have a sense of independence as well as having close-knit communities, that there is a sense of resilience that many individuals have built through solving the challenge sometimes of living in rural communities with a lot of the factors that we just described. So, and perhaps there's strengths that you would also name. So we want to be mindful that while we're going to talk today about a lot of challenges, there also are a lot of strengths. And so we want to hold both of those things together, both the challenges and the strengths throughout today's conversation. And so I'd actually encourage you in the chat to share what strengths or challenges are most resonant for you. If you're in a rural community, what challenges are the ones that are most present in your mind as it relates to behavioral health, perhaps some of the ones we've listed? And what about strengths? Are there strengths that you would name that you think we need to have in the room with us today as we begin this conversation? Please paste all those in the chat, and we'll have that conversation there as we continue with the next part of our presentation. Jennifer, I'll turn it over to you.
Yeah, no, I was just looking at a comment, and somebody had mentioned frontier areas does the designation instead of just rural. So we'll definitely talk about some factors that our frontier communities face that are even more unique. And certainly if there's additional challenges that we don't discuss today, please bring those forward in the chat. So appreciate your mentioning that. All right, so the next section is we're talking about factors impacting mental health and substance misuse in rural areas. And the thing about our rural communities is oftentimes they have the least amount of resources. They have the greatest amount of economic challenges. And with that, and this is statistically speaking, are oftentimes limited educational opportunities. And all of these three things together increase risk for mental health issues, increased risk for substance use issues. We have research that shows us that higher rates of death by suicide happen in our rural communities as compared to our general population. They oftentimes have a greater likelihood of untreated mental health conditions as well. So there is historically challenges that come with serving our rural populations. But as we shared on the headline, if you saw on the previous slide that Avery presented, we're beginning to figure this out. There's technology that can help us. So there's hope for our ability to reach all corners of our state. So we'll definitely be talking about that. But we also want to comment too that in our rural communities, not only are they smaller, but when tragedy strikes, it is really something that hits hard because of the closeness of the community. And that some of the conditions can also create increased risk for other, death by suicide. So we want to really make sure we're paying close attention to the needs of our rural communities, following their population health data so that we can really deliver the best behavioral health services in those areas. We also look at rural communities. They tend to be an older population by average, so with a higher percentage of people over the age of 65. And then there are unique stress challenges that come with our older communities as well. They have changing health, although saw this morning, we have a greater number of centenarians happening across our country because of our medical system. But with that, we know when people live longer, they can have more challenges. They can experience more loss, decreased independence. So there are some real issues that we need to pay attention to for our older adults as well. And they tend to be under-screened for mental health issues. So that's a really important that we pay particular attention to that in our all communities and in our rural communities. Okay, and then the last thing about rural communities is social isolation. So because there are oftentimes lots of mileage that can separate, sometimes even families, particularly we saw through the pandemic that social isolation, even for people who have very limited groups that they interact with, really increased challenges with mental health and substance use needs. So it is imperative that, we learn from our pandemic and we learn from what research is coming from our rural communities so that we can really adapt our mobile crisis teams and prepare them for providing really good quality care. Access to mental health and substance use care in rural communities is, across the United States is an issue with over 60%, and these are all recent statistics. We really tried to look to see what is really happening currently. So we know that over 60% of rural Americans live in what's called designated mental health provider shortage areas, where they have very limited access to psychiatry, behavioral health providers of all different types and disciplines. They have less access to what's called the full continuum of care. So everything from, preventative care to very intensive treatment care to integrated care, which is our best practice gold standard for working with people with co-occurring disorders. So with lack of access, that again increases risk for our rural residents. Individuals in reservation areas also have significantly lower odds of getting the care they need. So even when we're looking even more at those unique areas like our reservations and our frontier areas, we're seeing the greater disparity. The disparity is even greater. And then when we look at psychiatrists specifically, so when we have people who have very complex behavioral health needs who need psychiatry, about 65% of our non-metropolitan counties don't have psychiatrists. So having a face-to-face experience, you may be able to get a telehealth experience, or you're asking people to go far distances to be able to get their psychiatric needs met. So lots and lots of disparities we're facing with our rural areas. So, oops, we got a little excited here. All right, so we want to just chat with you for a second. What additional challenges do you find in meeting mental health and substance abuse needs in the rural areas? What challenges stand out to you? And also, what do you feel impacts your ability to meet those needs, specifically in our rural areas? So if you can just put some thoughts in the chat, and then we will all learn.
I also want to note from our prior prompt that we had some folks respond as well around the challenges that stood out to them. So I just want to repeat a few of those into the space while folks gather their thoughts around these two prompts. Folks highlighted no other licensed personnel, geography, weather, isolating sections of the community, and that's some of the things that we'll talk about today. So thanks for bringing that into the space. Limited cell service and internet. And this individual notes that contributes to a lack of knowledge about services offered, as well as the ability to contact services. So we're going to talk a little bit about self-service as it relates to telehealth, but that's a really interesting point around folks' awareness and being able to access and search for services. So thanks for bringing that into the space. And then on the strength side, folks listed being able to build strong partnerships with community partners. And then also as challenges, generational trauma and barriers from that. So we're going to talk a little bit about, we did name a little bit about privacy and stigma. And I think that those are connected to some of what you're stating there. So thanks so much for listing that. And I think that gets us caught up now to this prompt, Jennifer.
It sure does. Absolutely. And so some additional challenges, somebody mentioned housing, which absolutely is an issue. And you're going to learn through your mobile crisis team training that our delivery of services, not, what people call home and where they're at, that's where we go. So if they're living, with family members, if they're living in a shelter, if they're living, in non-traditional home environments, we're going to go there. But once we're there, being able to then connect people with safe housing. And that's going to be more challenging in rural communities because there may not be something or as many options for people that they can take a part of. So with counties mobilizing their implementation plan, I really encourage you to also build in what are some of the social drivers of health and some of the needs we might encounter that are unique to our community or shared by many others that we're going to want to be prepared to address. So whether it's basic needs, food, shelter, clothing, safety, how are we going to be prepared to address that if that's a big part of the crisis experience? Okay, not enough social activities. Absolutely, we hear that a lot. So with our communities not having things for people to do, everybody deserves the right to feel a sense of purpose. And coming together in groups and having, devoted activities that they can share together creates meaning and purpose. Without those opportunities, without festivals, without abilities to congregate and places and safe places to do that, it really does impact mental health. Okay, socioeconomic factors, absolutely. Limit accessibility to behavioral health, absolutely. Even copays for people. They may have some insurance, but the copay make the difference between being able to afford to get medication or seeing a behavioral health provider, being able to do something for a loved one, and then reaching out for their own behavioral health support. So our families are oftentimes making very, very difficult choices with limited economic resources. Many of these people choose to live in the outer because they want to be left alone. Absolutely. So we, being called to a location to not make assumptions that just because they're not living in a place where we would interpret that or put our own personal views in that as a safe place to live or an adequate place to live, that may be what that individual prefers. So when you're doing your assessments and the crisis assessment tools that have been people are working on or been brilliantly constructed, are really taking that person-centered approach into account so that our teams are going out there being able to engage in a conversation about what's most needed for the individual in need. Absolutely. So many crisis clients we see in the ER feel that they would not be in crisis if they did not have to return to where they're living. Absolutely, which is why we have to make sure our mobile crisis teams have some ability or resources that they can direct. And if not, feeding that information back to the administration and the leadership so that we can start to really engage in more conversations with community partners about what we're seeing in our work and what needs to be developed more to be able to keep people out of crisis. Absolutely. All right, we're going to move forward with the next part, which is really getting into some challenges and solutions in response to working in rural areas with our mobile crisis teams. So there's really 4 buckets that we're going to be talking about today. The first one is timeliness, then workforce, then technology, telehealth, and then safety. So somebody already mentioned housing, which I think is another really great bucket, or other social drivers of health. But there are other buckets that you can think of outside of timeliness, workforce challenges, technology, telehealth, and safety. And if so, please put those in the chat. So just in general, as we're walking through these next sections, to really think about and to put into the chat what challenges are coming up for you that you're faced, that you're concerned about in implementing the mobile crisis team in your rural area. So just what's unique about your rural area and what are some challenges that you could already sense might be present that you think are going to be good for us to listen to and learn from and discuss. Okay, so the first we're going to talk about is timeliness standards. I do want to point out that we have already developed a training that's been given on considerations and strategies for meeting timeliness standards. So we do know that this is going to be a real source of support that's needed for our teams. But we're going to go through some of what's in the bin and then discuss what another state is doing, give you some resources, but we know this is going to be an ongoing conversation. So the In the Bin provides the following. Mobile crisis teams shall arrive at the community-based location where a crisis occurs in a timely manner. They shall arrive within 60 minutes in urban areas, and that's of the beneficiary being determined to require it. So that's not necessarily from the point the phone call comes into dispatch, but once dispatch has decided that, yes, this person needs, our team to go out, the time from that point is 60 minutes in urban areas and 120 in our rural areas. So these timeliness standards are not included in network adequacy requirements or in certification. DHCS will be providing ongoing TAs in our open office hours to Medi-Cal behavioral health delivery systems to really help them to figure out ways to review response times and adjust to them as needed. So please know that's what those TA office hours are for. So if you're really struggling being able to figure strategies out, that's where we want to congregate and bring people together so we can learn from each other and potentially help each other in finding ways to decrease those response times. We do know Arizona's mobile crisis teams respond to their calls on an average of 30 to 40 minutes anywhere in the state, including rural areas. So there's things that Arizona's doing that we really want to make sure you know about. So they're Avery's gonna put a link in the chat to a resource so that you can all visit this resource and learn from how another state is doing it. Now, again, the topography is different in our states. Some of the population needs might be different, but I think some of these solutions could really help. So, and we'll talk about some of the solutions a little bit later on. But we really want to just address that, what's innovative oftentimes is things like GPS tracking. So if we can enable this live GPS tracking, we can coordinate so that the closest mobile crisis team is dispatched to a person in crisis, and that could be across city or county lines. So it's an opportunity to partner with other counties to really provide adequate coverage. So if you've got a real rural frontier area and you've got a very limited number of mobile crisis teams you can dispatch, but you're standing kind of close to another area, it might be a way to sort of enter in some sort of MOUs or just agreements and enable this kind of GPS ability to really help each other out. And then the other option is to use telehealth to provide support during the wait times for those in more rural locations. So there are definitely other crisis response services and telehealth options that we can utilize. So we're really trying to figure out how to best, make sure the resources get to the people as quickly as possible.
Jennifer, before we leave the timeliness piece, I also want to mention as an accessibility issue, one of the things we talked about as we were developing this presentation, and many of you brought up weather, I saw weather brought up a few times, is the challenges that might be presented by weather. So if you're living in an area that gets large amounts of snow that requires you to travel a long distance, and then you have the additional barrier of snow, that could also impact timeliness. So we want to bring that into the space for folks who are living in places where that may be true. And some of the recommendations that folks discussed as we were developing these materials is access to all-terrain vehicles, that may be for some folks a necessary component of what you have. Certain times of year is that you have different vehicles that allow you to access different parts of your rural community if snow, particularly, for example, is something that you're having to deal with on a regular basis. So I wanted to bring that up as it relates to timeliness, because that can certainly be a factor as well. So we're going to go to our second area, which is workforce. And if you've, again, been attending some of these presentations, this is building on past conversations that we've had around workforce development. Workforce development around behavioral health, as many of you have already noted in the chat, is an issue in general for rural communities. And so mobile crisis is playing an interesting role. You both have both the challenges, perhaps, of some workforce development, which we're going to name and talk about solutions, but also mobile crisis is in the unique position of providing services in a way that is in some ways an answer or response to the lack of licensed professionals and a lack of enough volume of behavioral health professionals in your community. So both you're facing similar challenges and you're part of the solution. So here are some of the challenges. Identification of folks who are qualified to be able to work as part of your mobile crisis staff. Retention of individuals. We've specifically heard for overnight shifts that retention of folks to work overnight shifts can be challenging. Issues of privacy and anonymity. And this came up as it relates to highly rural communities, that particularly if you're thinking about utilizing peers, for example, or any other licensed professional, that in small communities, it's more likely that individuals know those individuals who may be responding to their crisis in a personal level. They might be related to them, right? They might be part of their extended family network or community network, religious community network. And that can sometimes create some additional challenges, either of the individual being responded to, perhaps not wanting help from that individual person, or there being some type of conflict for the person responding. And while this could happen anywhere, this may be more likely in a rural or a small community and close-knit community. If you have other challenges that relate to workforce, as we start moving over towards solutions, I invite you to also put those in the chat, but those are a few that we identified. So what about solutions? What solutions can we think to implement to adapt to some of these workforce challenges? Well, one, harkening back to a prior training around community partnerships, is to leverage community partnerships specifically for recruitment. As part of your implementation of mobile crisis, part of the work that you're going to be doing is collaborating with community organizations to talk about what you're up to with mobile crisis, to invite them to come to the table and be your partners in implementing this approach in your community. And that partnership is an amazing opportunity to also name that one of the things that's innovative about this approach is the engaging of peers and community-based health workers, and that you want to invite them to identify individuals who maybe would want to participate in being trained and learning how to be part of a mobile crisis team. So we identified early on how community and community partnerships is one of the strengths of rural communities, and that's certainly something that can be leveraged here as it relates to workforce development and recruitment. A few other strategies that we've identified and others have identified, and of course, we'd also love to hear your suggestions in the chat as it relates to recruitment and retention. There are financial strategies. So thinking about how bonuses could be implemented, loan repayments for individuals who have student loans, financial benefits of those types to serve as an incentive to individuals wanting to participate and sign on to be part of a mobile crisis team. Another recommendation, which has been implemented in some other states using mobile crisis, is taking a different approach to shifts. So thinking about in rural areas that there may be more success with a different shift model, with a 24 or 48-hour shift. And some preliminary findings from the folks who did implement this in Washington State, and you can see the link there on the slide, and you'll have access to this as well. This was implemented in rural communities in Washington State. And what they found was that this perhaps improved safety, decision-making, rapport building with teams and beneficiaries. They're working together across a longer period of time. It also can improve work-life balance because folks have more time off next to that large amount of time on working, and that can help with retention efforts. So that's another thought, is thinking about how to perhaps take that different approach to shifts, and you can learn more about what Washington State did there in that link if you're curious to hear about their approach. And then the other approach is to think about how to utilize telehealth, and we're going to be talking about telehealth today and the ways that telehealth can be utilized. That came up in Jennifer's comments as well around timeliness standards of how telehealth could be utilized to supplement with timeliness standards. But telehealth can also be used and implemented per the recommendations in the BIN and the guidelines in the BIN as a way to think about buffering your workforce. So that's another solution. And again, not without its challenges that we'll be talking about here in a moment. And that brings us to telehealth. So that closes workforce. And Jennifer, thank you for putting the link there in the chat. If you have additional challenges that you're facing around workforce or solutions that you've come up with, we'd love to hear them in the chat, because that's really how we learn from each other. What I love, for example, about that example from Washington is that's an example of the state saying, hey, here's something we've tried and it's worked. So if you find something that you're trying that seems to be working, we would love to see that there in the chat as well. So telehealth. Telehealth, we know, is a part of the benefit in the BIN. And we've talked about in prior trainings the variety of different ways that telehealth can be utilized. There are perhaps some particular challenges in implementing telehealth in rural areas. And we heard some of you already mention some of those in the chat, so we want to name them here. chief among them being access to cell service and internet broadband. As someone who's lived in a rural mountainous area, I was sharing this with someone as we were developing this training. I could not get cell service without going to the end of my very long driveway in order to get a cell phone call. And when the weather was cold and snowy, that was less than ideal. And so that's what many people in rural communities do deal with on a regular basis as it relates to cell service and broadband. And so clearly for telehealth, that may present a challenge as you're utilizing telehealth either as a supplement to two individuals on a team or one individual who's responding, and you're needing to utilize telehealth. A lack of access to cell service can certainly be a problem, or a lack of access to broadband if you can't tie into Wi-Fi. Privacy for the individual in crisis. We've talked about home environments a lot in this training. We've talked about how folks may be in environments that aren't particularly safe for them, or how the home environment may be contributing to their crisis. And so individuals not having privacy, being concerned about individuals overhearing, that can certainly be a challenge as well. I also noticed some folks replying here in the chat, so I want to capture that as we move on to talking about solutions. One individual mentions also limited access to satellite service due to tree coverage, so that there may not be a backup mechanism. And thanks for sharing that. That's really important to know that that may also be a challenge. So those are some of the challenges. So here's some of the solutions. So one is telehealth equipped mobile units. And so that could look like having mobile hotspots. That could be one solution that may have a stronger access to the network than just a typical cell phone or other typical device, something that bolsters that signal. So that's one solution. One solution that the research suggests is satellite. So I'm hearing in the chat that sometimes satellite still isn't an option, but that would be a backup solution, is to have access to satellite wherein that's practical. Thank you so much for saying in the chat, voice of experience, right? That tree coverage might get in the way. So that might still be a problem. This next solution, which I think is really drawing a lot of what we've talked about community partnerships, is partnering with local community centers or nonprofit organizations, even a restaurant or a cafe that has a space that's quiet and that has reliable Wi-Fi. So if someone doesn't have reliable access to cell service or Wi-Fi, you can actually, you could encourage them to meet you at a central location that feels safe for you and for them, where you could perhaps utilize the Wi-Fi in that space. And so developing those relationships in order to build agreements and arrangements to use a space on a regular basis for your purpose and use their Wi-Fi if you need to access telehealth may be one solution, especially if the tree coverage gets in the way, right, of your satellite. So now we're going to talk about safety, and there's a lot to be said here. I'll pass it over to Jennifer.
Absolutely. And Jessica mentioned that most of the rural areas have no services at all. So we're definitely going to address that in this slide because that is a huge issue. So for a lot of our rural locations, the isolation factor is a huge deal, and some possible solutions. And I'll be interested to know what other solutions people might have, to put those in the chat. One is to make sure that your mobile crisis team check in and check out with dispatch, which means, you know, that they check in that they've arrived on location, and then they check out after they leave the location. So that allows us to have a good sense of where our teams are at when they've completed their service, so that we know they're safe. The other thing is to also, if they're going to be there for an extended period of time, is to have them just check in on a text message that they're doing okay, or have some sort of system if you want to do a different special word that you want them to only know. So there can be different things that you can come up with your teams to help promote safety. I know when I did in-home family therapy, we did that quite regularly when we would go out into some remote areas. So we had just different things that allowed our teams to feel safe in going into locations where there was very limited visibility or other resources close by. It may also be good practice. We talked about that with the longer sessions. Again, the text check back and having like a special word that you might want to use to do that. Another one is to have them leave the GPS tracking on their phones, or if you have some sort of booster that they're going to carry with them, so that you know exactly where they're at and that remains with them at all times during their visits. So for the lack of cell phone service issue, I did some research, and Avery and I looked around But you can make sure that all of your team members have hotspots available to them. So cellular hotspots that ensure they have access to the internet. They should also have what's called an FCC approved cell phone signal booster that helps improve signal strength in areas where the signal strength is known to be problematic. So it is called an FCC approved cell phone signal booster. EMTs and other first responders in your counties may have strategies also that they're using for how they address this issue. So we encourage you in those community partnership and stakeholder meetings to bring that up and to find out how other responders are dealing with some of these challenges out in the rural frontier parts of your community and your county. So that's a real helpful resource, I would say, for people who may have already begun to address this, who are going to be going into some similar spaces or have gone into similar spaces. Safety codes, absolutely. Send updates, safety codes. Right. So our chief suggested learning some LEA chiefs suggested learning their safety codes to send updates to local law enforcement. So, right, if you're doing a joint dispatch model, or maybe you're having standby just in case, and you want to send a code to somebody that lets them know things are going well, it's de-escalating, or you have a code where please continue to stand by, or you have a code that says, yes, please come in. So absolutely, you can develop communication systems so we're minimizing and best utilizing our community partners, particularly law enforcement. Absolutely. Really like that idea. Some other safety solutions. Obviously, training is going to be really important with your teams. So common safety scenarios, and then having kind of agreements among your teams on how you're going to handle those and what the protocols are, having them teach them back to you so they learn it and they teach it back so you know that they understand it and remember it. That is really, really very important. These things are going to kind of evolve as you gain more experience in your counties with your teams. So you're going to want to probably schedule some trainings a couple of times a year or more often if needed, where you're going to run through some of these safety scenarios. I always had my trainees do what's the worst case scenario you can think of. Okay, let's run through it. So because everybody's kind of holding different thoughts and ideas of what would be difficult, including the supervisors. So running those scenarios is helpful. Using peer supports and community health workers who are from those locations and familiar with those rural areas, who are familiar with the culture and who are a part of it, or who have rapport and established relationships, can be very, very helpful to not only identifying potential safety concerns, but to being able to go into those locations a little bit easier so that they can help people in crisis. So really using peer supports and community health workers, and that is in the bin, as part of your team composition can be a great strength in some of our remote areas. And then working with local community centers and business owners to sort of have centralized meeting places. So if the signals aren't great, the terrain isn't great, the weather is prohibitive to kind of getting to some of these places, but they have all-terrain vehicles to be able to get to another location, working with your local establishments to try to find spaces where you can do these mobile crisis team interventions would be a really helpful tool. All right, and then equipping the team for wilderness. So I really wanted to talk with you a little bit about this because Avery had discussed this a little bit earlier when she talked about, it could be that, we had inclement weather, and, in California, there's some spaces that'll have snow while other spaces, the weather's beautiful. So it really depends, knowing your region, knowing when your mud seasons are, and then making sure your teams and their vehicles are equipped to be able to navigate the terrain, or maybe even having an emergency pack with them. There's been times where I went out where it was fine, and then while there, the snow came. So maybe wanting to make sure that all of our teams have the potential safety gear with them in the event they should get stuck. Spared battery charging bank and a cell phone that has emergency satellite connectivity would be really important. Vehicles, again, should have all-wheel drive if possible and have snow chains when needed. may want to invest in a snowmobile depending on weather conditions in your location. And that might be something, again, to talk to your emergency services system about, to see what's already accessible and potentially available, or where you can maybe partner to get more equipment. And then making sure all of our teams have survival gear, blanket, flashlight, water, additional resources, some food, radios for communication, just in the event that they should get stuck or stopped. The other thing I will mention is, and this has been taught in a few different spaces, is we never know when we're going to encounter wildlife, when we're going to encounter domestic dogs, dogs that are protective of their owners. So we've actually heard from some people to carry like dog treats with you, like Pepperonis, which is a brand, but to just find some dog treats. So in the event that you are with or around an animal who's uncertain, if you can throw these things out and buy yourself some time to get to a safe space back in your car, until somebody else can, if it is a pet, somebody can, restrain them or put them in another location. Now, in our dispatch tools, we're trying to identify some of these things before your teams go out, but we never know once we get there if, something appears that wasn't there before when the call was made. Some strategic partnerships with law enforcement too. So occasionally safety concerns are going to need law enforcement accompaniment. So remember, the bin says we want to only utilize law enforcement when we need to, because in some instances, when we send law enforcement out for behavioral health crises where it's not needed, we do know that it can lead to greater arrests and incarceration of our beneficiaries. So we want to really utilize some real evidence-based decision making and figuring out when it is best to send law enforcement to respond either before or in joint or even on standby scenarios where we're dispatching our teams. So there is some language in the bin. We encourage you to continue to revisit that as you're building out your community partnerships with law enforcement, so that there's really those clean and clear lines of communication that really protect the integrity of the mobile crisis team services and respecting the safety of our beneficiaries.
And Jennifer, I'll note that there will be a future conversation that's just focused on safety, because this conversation, while this is a particular perhaps interest in rural communities, this has come up on a lot of our trainings around how to address safety. And so there will be some future conversations. So please be on the lookout for those invitations.
And really, and the one thing that I didn't mention that I'm glad you had a pause on this too, is we have to make sure that the benefit is covered, because law enforcement involvement may lead to, it depends on the circumstances where the benefit would not be covered. So that's why we're really trying to be clear with our teams. If somebody on law enforcement is trained in CIT and they've undergone that designation, there's just certain circumstances where, they may not be able to be covered under that mobile crisis team benefit, and some where they might be. So we've put on the slide where those pages are if you want to go and look. But again, as Avery said, we'll be covering this some more in future trainings as well. Okay, so just general discussion, and I know we're just a few minutes behind, so I think what I'm going to do is sort of just have you put into the chat. Are there any innovations that you or your community are thinking about, knowing your geography, knowing your rural counties and communities, that you're thinking could really help benefit? So if there's anything we haven't mentioned, other strategies that might be working or might work, please put them in the chat.
Okay, so now we're going to talk a little bit more about community engagement. We've woven that throughout this conversation. And I think to harken back to a prior training where we talked about particularly building collaborations for the purpose of coordination. And that training, if you haven't watched that, I encourage you to watch the recording. One of the things we talk about is how important it is to, as part of this model, this is a person-centered model and also a community engagement model, that we're really engaging the communities people live in. And in rural areas, this may be even more important. And we've seen that through the way that you've replied to some of the prompts today. So some opportunities to think about how to engage community. One recommendation would be to create a community stakeholder meeting. And this, in fact, was one of the recommendations in our collaboration and coordination training, is to create a stakeholder meeting to receive feedback from the community about mobile crisis, about what you're up to, about how you're trying to implement it, and to co-create solutions for some of the challenges you may be facing. So as we talked about earlier, one of the unique strengths of rural communities is folks are oftentimes do look out for each other around some of these challenges, be it weather or isolation. So invite the community to the table to talk with you about some of the challenges you've identified as it relates to your implementation of mobile crisis, and invite them to partner with you in co-creating solutions. This goes also for safety concerns, talking about safety concerns, listening to the community's notes around safety and their concerns about mobile crisis, and then also how you can partner together to address those concerns. Also, we want to name tribal specific considerations when we think about many tribal communities existing in these counties that would qualify as rural, that oftentimes there are go-to families or elders or places that serve as a source of support for tribal communities. So when you think about community collaboration, think about including those tribal leaders specifically in your community stakeholder meetings. Think about identifying who those key point persons are and make sure you're getting their buy-in into what you're trying to create with your mobile crisis implementation. Consider even training key individuals in the community. If there are go-to trusted elders or others, consider training those individuals about mobile crisis services to increase the community engagement in and community collaboration with the model that you're trying to implement. So just a few good examples around community and how to potentially engage communities. So this brings us to a summary of our presentation, then we're going to have some time for Q&A. So here are some of the things we've talked about today. We've talked about that mobile crisis teams need to innovate to think about accessibility challenges in rural communities. We've talked about the strengths that rural communities have. And we've also talked about that there are a lot of challenges that rural communities face as it relates to behavioral health and SUD, including a higher incidence of mental health challenges, substance use disorders, co-occurring disorders, and also simultaneously, oftentimes having lower access to behavioral health care services. We've talked about additional challenges around accessibility, such as lack of access to providers, transportation, which has come up over and over again, even as we've offered some of the solutions. I've seen in the chat that you all have been very pragmatic with us about the challenge of transportation, just distances that people may have to travel. We talked about stigma and also privacy concerns and how that can be particularly heightened in rural contexts. We've talked about some of the characteristics of rural communities that may place folks at additional risk on some of those risk factors and also protective factors. And we've talked about specific challenges you're probably going to face as you try to implement mobile crisis. We've talked about workforce, we talked about response times, technology and telehealth, and also safety. And then we've talked about how to engage the community. Here are a few resources that we encourage you to look at where a lot of our research went for this presentation to supplement our own knowledge. I specifically want to call out for you the Rural Health Information Hub, which has a variety of toolkits around rural health in general. Not all of it is behavioral health specific, not all of it is mobile crisis specific, but a lot of really solid information around rural health in general. If you're already working in a rural area, you may know that resource, but I particularly want to point that resource out to you.
But if there are any really important questions, you can put them in the Q&A. If we don't get an opportunity to get to them right now, we will respond to them after the training is over. So please feel free to put your questions in Q&A. If you have any that you want to bring up, I think you can. I do see some things in the chat, like meeting in public spaces is a challenge with lack of transportation. I think Avery had talked about that. So you're right. There's not one strategy is going to work for each location, which is why we want to meet you where you're at and really help support you. So those technical assistance office hours and then those community partnership stakeholder meetings are going to be really important to be able to do that. If we don't have any other burning questions right now, again, we're always going to be accessible to you through the TA, through the Q&A. Afterwards, you can get up with Cars who will get us questions and we will help respond to them as soon as possible. There's some references. Remember, your feedback is really, really important to us. And I guess that's a big thank you.
Thank you so much for participating in this training and for all of your feedback in the chat. We hope you have a great day.
Have a great day, everybody.
Bye all.